My name is Annick EHR and I'm going to give a presentation on electronic health records. I'm currently working in the goal called Utilize Healthcare Data. Welcome to my presentation. Starting by an introduction, according to the Centers of Medicare and Medicaid, ND, electronic health records is an electronic version of patients' medical history that is maintained by the provider over time. In other words, you can say that it is a computerized system or that medical practices are currently using instead of using paper charts. It may include all the key administrative, clinical data relevant to the person's care under a particular provider. It also includes demographics, progress notes, problems, medication, vital signs, past medical history, as well as immunization, laboratory data, and radiology reports. So moving on, discussing two components that of electronic health record that support direct clinical care. We have about three, and according to Carter 2014, like the source I got, the author was Carter. And the date of publication was, the year of publication was 2014. The first component is clinical component, which include computerized provide order entry, electronic documentation, nursing component, as well as pharmacy system. Discussing each component in this first component, by starting with computerized provider order entry, which allow healthcare providers to enter directly in a computer orders that are needed for patient management. This component make the use of clinical decision support tools. For example, we have drug to drug allergy, as well as drug diagnosis interaction. Moreover, it assists the health care providers to make the decision regarding the patient care. Moving on, the second component, there is electronic documentation by providers, which allow health care providers to document notes such as history, such as physical history and physical consult, discharge summaries, as well as operative notes. We also have the pharmacy system, which allows for maintaining a drug formulary, filling a prescription, and cross-checking order that is pressed by providers in the electronic health records. Moving on, on nursing component, it allows for correction of key patients information such as vital signs, input and output. Moving on, the second component of electronic health records that support direct clinical data, we have laboratory component, which includes capturing the results from lab machines and integration with others, billing and lab machines. This is also according to Carter 2014. The third component is radiology information system and picture archiving and communication system, which is used to manage patient workflow as well as ordering process, result, and the images themselves, according to Carter 2014. Moving on, the benefit of these components that support direct clinical data, according to health.gov 2014, due to computerized physician order entry, it reduces the time as well as errors that might occur. These components make it easy to access clinical data, and it is easy to write the order that are needed for the patient management. They help to identify the history of the patient's health care in case it is needed, and it is easy to maintain a drug formulary, as well as it is easy to capture the results from lab machines. And with this component, it is easy to manage patient workflow and ordering process. The issue of the component that support direct clinical care, according to Melakemi and Column 2011, there is an issue of lack of uniform approach of documentation. There is also some mistakes in typing, which might occur, There is delays in documentation, having some challenges in the use of the components, which sometimes require trainings for people who are going to use it, and there is also deficiency in standard terminologies. Like, moving on, the two components of electronic health records that support administrative process, we can have a patient management component, which is required for a patient registration, admission, transfer, and discharge. This is according to Carter 2014. Patient registration includes key patient information such as demographics, insurance information, contacts, and also contact information. There is the second component that supports direct administrative process. We have billing system, which is used to capture all charges generated in the process of taking care of a patient. This is also according to Council 2014. The benefit of the two components that support administrative process, we have it's easy the process of recording and identifying a patient's record for each patient. Also, this component easy to capture, maintain, and manage the patient demographics information, and also the billing system is easy and fast for the administrative as well as the patients. There are still some issues in the use of this component which support the administrative process, and these are some errors occur in billing, and this ruin the reputation of the company or the hospital or the healthcare professionals. If not familiar with these components, it is challenging to use them, as well as it has difficult terminologies. There is an importance of the integration of administrative and clinical area for effective use of electronic health records. You can wonder what are those importance. The first one is easier access to clinical data. It enhances the ability to establish and maintain effective clinical workflows. Another importance is that fewer medical errors occur, which impact the improved patient safety and stronger support for clinical decision making. There is also the opportunity to interact with affiliated hospitals, clinics, labs, and pharmacies, greater staff and providers efficiency due to ease of recording, storing, managing, and retrieving patient information. There is also recording and tracking of quality measures, enabling improved physician productivity and access with incentives program. Another importance is a more efficient and cost-effective workflow. We also have easy sharing of information by doctors because they are online, and also improve communication within the staff, where it is easy to assign tasks because it is electronically, as well as it is easy to review staff productivity by examining health providers and staff output. For more information, I provided a reference for that will guide you, and thank you for your attention.